योगः कर्मसु कौशलम्.
Good morning. Myself, Dr. Renu Principal, JG College of Education. Today, we are going to discuss about mental health and awareness. Before beginning the topic, I would like to thank HRDC, Gujarat University, as well as Department of Education for providing me the opportunity to interact with you all. I would also like to thank Professor and Head, Department of Education, Dr. Milan Mistry, for giving me this opportunity to talk with you all. So thank you HRDC Gujarat University as well as Department of Education. Now we'll begin our today's topic, that is mental health and awareness. First of all, what do you mean by mental health? Mental health includes our emotional, psychological, as well as social well-being. It affects how we think, how we feel, and how we act. Means that whatever emotional feelings we are going through, whatever the mental aspects we are going through, that reflects in our social behavior and how we are fit physically, mentally, socially. It depends on our mental health. So, mental health also determines how we handle our stress, how we relate to others, means how we behave with others, how we deal with others, how we tackle the different situations, and how we are able to make our choices or decisions. So, mental health is basically the balance of our emotional, psychological, and social well being. According to the WHO, mental health is a state of well being in which an individual realizes his or her own abilities. An individual can cope up with the normal stresses of life. An individual can work productively and is able to make contribution to his or her community. The WHO stresses that mental health is more than just the absence of mental disorder or disability. Mental health does not mean only that absence of mental disorder, but it is basically the balance of our physical and emotional aspects. Peak mental health is about not only avoiding active conditions but also looking after ongoing wellness and happiness. Means we should have a happiness in our life. We should be able to deal with different situations with calmness. We should not be stressful. WHO also emphasizes that preserving and restoring mental health is crucial on an individual basis as well as throughout different communities and societies the world over. Because if we are mentally fit, then only we can work productively, otherwise, not. Before understanding the mental health, we should also know that what is the meaning of mental illness, because we are mentally healthy or not, that will depend that we are free from the problems or the mental illnesses. So once we know that what is mental illness, how we can avoid such situation, then only an individual can remain mentally healthy. So Illness are the health conditions involving changes in emotions, thinking, or behavior, or a combination of both. Mental illnesses are associated with distress and or problems functioning in social, work, or family activities. Mental illness, also called mental health disorder, it refers to a wide range of mental health conditions, disorders that affect your mood, that affect your thinking and behavior. Examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorder, and addictive behaviors. Many people have mental health concerns from time to time, but a mental health concern becomes a mental illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. Mental illness does not mean that once we are stressed or for time being we could not make decision or we are frustrated. But if these symptoms continues for long period of time, if we are stressed and these things are hampering our ability to function properly, then we can think that we are suffering from such mental illnesses. A mental illness can make you miserable and can cause problems in your daily life, such as at school or work or in relationships. In most cases, symptoms can be managed with a combination of medications and drug therapy. So, if we feel that we are suffering from any mental illness, we could not deal with the situations, we are not able to work properly, we are not able to handle our relationships properly. So, in that cases, we should understand that we are facing such problems, and surely we should go to doctor, we should have medication, we should talk to somebody and try to solve our problems. There are different types of mental illnesses like mood disorders. Basically, we term this as a depression, anxiety disorders, personality disorders, psychotic disorders, eating disorders, trauma related disorders, substance abuse disorders. Today, we'll basically talk in detail the first two, that is mood disorders and anxiety disorders. Mood disorders. What is mood disorder? In daily life, we hear the term depression. What is this depression? If an individual is not healthy, if an individual is suffering from some problem, if the individual is not able to tackle the stress, he or she may be depressed. If an individual has mood disorder, his general emotional state or mood is distorted or inconsistent with the circumstances and interferes with his or her ability to function. Individual may be extremely sad. Individual may feel empty or irritable. An individual may have periods of depression alternating with being excessively happy. Anxiety disorders can also affect individuals' mood and often occur along with depression. Mood disorders may increase individuals' risk of suicide. Some examples of mood disorders include major depressive disorder, means it is prolonged and persistent period of extreme sadness. Next, bipolar disorder. It is also called manic depression or bipolar affective disorder, depression that includes alternating times of depression and mania. Next type of mood disorder is cyclothymic disorder, a disorder that causes emotional ups and downs that are less extreme than bipolar disorder. Next is premenstrual dysphoric disorder, mood changes and irritability that occur during the premenstrual phase of a woman's cycle. This also has a problem due to which we had mood disorders or our mood swings. Persistent depressive disorder. It is a long term or a chronic form of depression. Then the next type of mood disorder is disruptive mood dysregulation disorder, a disorder of chronic, severe, and persistent irritability in children that often includes frequently temper outbursts that are inconsistent with the child's developmental age. Depression related to medical illness. Many people, those who have long term medical problems, they also face depression. A persistent depressed mood and a significant loss of pleasure in most of all activities that directly related to the physical effects of another medical condition. So for a long period of time, people is suffering from some disease. They feel very sad. They don't have zeal to live life. They are consistently sad. They don't want to leave because they lost hopes that they will be happy, they will be completely or perfectly all right in future. So the long-term illness also is a cause of depression. Depression induced by substance use of medication. Depression symptoms that develop during or soon after substance use of withdrawal or after exposure to a medication. For most people, mood disorders can be successfully treated with medication and talk therapy. After mood disorder, now we'll see the anxiety disorders. What do you understand by anxiety disorder? Anxiety disorder is a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. Experiencing occasional anxiety is a normal part of life. However, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear, or terror that reach a peak within minutes. Individual can face panic attacks also. These feelings of anxiety and panic interfere with daily activities. The anxiety disorders are very difficult to control. They are out of proportion to the actual danger and can last a long time. People may avoid places or situations to prevent these feelings. Symptoms may start during childhood or the teen years and continue into adulthood. Examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder, social phobia, specific phobias, and separation anxiety disorder. An individual can have more than one anxiety disorder at a time. Sometimes anxiety results from a medical condition that needs treatment. Many times we have observed that people avoid going to social functions because they are anxious. They are anxious for their physical appearance. They are anxious that how people will see to us. People may mock on us. So, due to different reasons, they avoid the social functions or facing friends also. Whatever form of anxiety individual have, treatment can help them out. There are different symptoms through which we can come to know that individual is suffering from anxiety disorder. The common anxiety signs and symptoms include feeling nervous, restless, or tense. If we observe that individual is consistently feeling nervous, restless, or tense, then it can be journalized that the individual is suffering from anxiety disorder. Having a sense of impending danger, panic, or doom. Having an increased heart rate, breathing rapidly, sweating, trembling, feeling weak or tired, trouble concentrating on thinking about anything other than present worry, having trouble during sleeping, experiencing gastrointestinal problems, having difficulty in controlling worry, having the urge to avoid things that trigger anxiety. So we see that these symptoms can be experienced during different times. Maybe an individual is writing exam and is feeling anxiety. Maybe guests are coming at home and they don't want to face or they are facing some problem. So if we see these symptoms consistently, once or twice, it is okay. But if this is on regular basis and always, then we should take it as a mental illness and try to see a doctor. Types of anxiety disorders. There are different types of anxiety disorders. Agoraphobia. It is a type of anxiety disorder in which individual fear and often avoids places or situations that might cause him or her to panic and make individual feel trapped, helpless or embarrassed. Another anxiety disorder may be due to medical condition which includes symptoms of intense anxiety or panic that are directly caused by a physical health problem. Generalized anxiety disorder. It includes persistent and excessive anxiety and worry about activities or events, even ordinary routine issues. The worry is out of proportion to the actual circumstances. It is difficult to control and affects how individuals feel physically. It often occurs along with other anxiety disorder or depression. The next is panic disorder. It involves repeated incidents of sudden feelings of intense anxiety and fear that react a peak within minutes means it's like a panic attack. Individual may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering or pounding heart. These panic attacks may lead to worrying about them happening again or avoiding situations in which they have occurred. Selective mutism is a consistent failure of children to speak in certain situations, such as school, even when they can speak in other situations, such as at home with close family members. This can interfere with school, work, and social functioning. Separation anxiety disorder. This is again anxiety disorder in which a childhood disorder characterized by anxiety that's excessive for the child's developmental level and related to separation from parents or others who have parental roles. It may be due to death of parents, natural death or the accidental death before time, or maybe the divorce of parents. So, this type of anxiety disorder may occur. Social anxiety disorder or the social phobia. It involves high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, self consciousness, and concern about being judged or viewed negatively by others. Specific phobias are characterized by major anxiety when you are exposed to a specific object or situation and a desire to avoid it. Phobias provoke panic attacks in some people. Substance induced anxiety disorder. It is characterized by symptoms of in- intense anxiety or panic that are a direct result of misusing drugs, taking medications, being exposed to a toxic substance, or withdrawal from drugs. Other specified anxiety disorder and unspecified anxiety disorder are terms for anxiety or phobias that don't meet the exact criteria for any other anxiety disorder but are significant enough to be distressing and disruptive. An individual should see doctor if these symptoms are seen in them. First, if the individual feel like worrying too much and it's interfering with the individual's work, means he could not work properly, productively, an individual is facing problems and relationships or in other parts of life. So an individual should see doctor. Next, if the person is fearful, worry, or anxiety, or is upsetting, or he or she is not able to control the difficulties, then the individual should see the doctor. Next, if person feels depressed, have trouble with alcohol or drug use, or have other mental health concerns along with anxiety, then he or she should see a doctor. You think your anxiety could be linked to a physical health problems. If the person is having suicidal thoughts or behaviors, if this is the case, then immediate treatment is needed. If the person worries may not go away on their own and they may get worse over time. If they don't seek help, then they need immediate doctor help or a mental health provider before the anxiety gets worse. It's easier to treat if the help is given timely. The causes of the anxiety disorder are basically the life experiences such as the traumatic events which has appeared in the life, and that trigger anxiety disorder in people. Many times inherited traits can also be a factor for anxiety disorder. There can be a medical cause also for the anxiety disorder. For some people, anxiety may be linked to an underlying health issue. In some cases, anxiety signs and symptoms are the first indicator of a medical illness. If the individual's doctor suspects your anxiety, they may help you, they may guide you to have different tests and can look for the real problem due to which the anxiety disorder take place. Example of medical problems that can be linked to anxiety are heart diseases, diabetes, thyroid problems, respiratory disorder such as chronic obstructive pulmonary disease and asthma. This may happen due to misuse of drugs or withdrawal. Withdrawal from alcohol, anti anxiety medications, or other medications. Chronic pain or irritable bowel syndrome. Rare tumors that produce certain fight or flight hormones. Sometimes anxiety can be a side effect of certain medications. Different complications can be seen due to this. Having an anxiety disorder does more than what makes you worry. It can also lead to or worsen other mental and physical conditions such as depression, substance misuse, trouble in sleeping, digestive problems, headaches or the chronic pain, social isolation, problems functioning at school or work, poor quality of life, and suicidal tendency. How these things can be prevented? There is no way to predict or certain what will cause someone to develop an anxiety disorder, but you can take steps to reduce the impact of symptoms if you are anxious. First, you should get help early. Anxiety, like many other mental health conditions, can be harder to treat if you wait. So as soon as you face problem, you should try to get help. Stay active. Participate in different activities that you enjoy and that make you feel good about yourself. Enjoy social interaction and caring relationship, which can lessen your worries. Means you should not remain alone or aloof, but try to be active, try to meet people, try to talk with them. Next, avoid alcohol or drug use. Alcohol and drug use can cause or worsen anxiety. So, if you are addicted to any of these substances, quitting can make you anxious. If you can't quit on your own, see your doctor or find support or group to help you out. Treatment includes counseling or medication, including antidepressant. So as soon as you face problem, you should try to find out solution for this. There are different causes of mental illness. Mental illness in general are thought to be caused by a variety of genetic and environmental factors. Mental illness itself occurs from the interaction of multiple genes and other factors, such as stress, abuse, or a traumatic event, which can influence or trigger an illness in a person who has an inherited susceptibility to it. Inherited traits means mental illness is more common in people whose blood relatives also have a mental illness. Certain genes may increase your risk of developing a mental illness, and your life situation may trigger it. Other than this, environmental exposures before birth. Exposure to environmental stressors, inflammatory conditions, toxin, alcohol, or drugs while in the womb can sometimes be linked to mental illness. Then, the brain chemistry. Neurotransmitters are naturally occurring brain chemicals that carry signals to other parts of your brain and body. When the neural networks involving these chemicals are impaired, the function of nerve receptors and nerve system change, leading to depression and other emotional disorders. Following symptoms can be observed. Signs and symptoms of mental illness can vary depending on the disorder, circumstances, and other factors. Mental illness symptoms can affect emotions, thoughts, and behaviors. Basically, if we see the examples of mental illness, we can see the individual is feeling very sad or down. He or she is confused in thinking, or his or her ability to concentrate is reduced. He or she is always in excessive fear or worry, or always in an extreme feeling of guilt. He or she has extreme mood changes, withdrawal from friends and activities, significant tiredness, low energy, problem in sleeping, detachment from reality, hallucinations, inability to cope with daily problems or stress, trouble understanding and relating to a situation and to people, problems with alcohol or drug use, major changes in eating habits, sex drive changes, excessive anger, hostility, or violence, suicidal thinking. Sometimes symptoms of a mental health disorder appears as a physical problem such as stomach pain, back pain, headaches, or other unexplained aches and pains. There are different risk factors. Certain factors may increase your risk of developing a mental illness, including a history of mental illness in a blood relative, such as parent or siblings. Stressful life situation, such as financial problem, a loved one's death, or a divorce. An ongoing medical condition, such as diabetes. Brain damage as a result of a serious injury, such as violent blow to the head. Traumatic experiences such as military combat or assault. Use of alcohol or recreational drugs. A childhood history of abuse or neglect. A previous mental illness. Mental illness is common. About 1 in 5 adults has a mental illness in any given year. Mental illness can begin at any age from childhood through later adult years, but most cases begin earlier in life. The effect of mental illness can be temporary or long lasting. You also can have more than one mental health disorder at a time. For example, you may have depression and a substance use disorder. There are different complications due to mental illnesses. Mental illness is a leading cause of disability. Untreated mental illness can cause severe emotional, behavioral, and physical health problems. Complications sometimes linked to mental illness include unhappiness and decreased enjoyment of life, family conflicts, so relationship difficulties, social isolation, problems with tobacco, alcohol, and other drugs, missed work or school, or other problems related to work or school, legal and financial problems, poverty and homelessness, self harm and harm to others, including suicide or homicide, weakened immune system, so your body has a hard time resisting infections, heart disease, and other medical conditions. Now, as we have seen, mental illnesses, different types. Now, what is mental health awareness and why it is needed? What is the importance? May is a mental health awareness month, a time to recognize a range of issues, depression, bipolar, and schizophrenia, among them, and the effects they have not only on the people personally experiencing and struggling with them, but on society at large. But what does it mean to be aware of mental health exactly? And how does that awareness manifest? Mental health awareness meaning. According to Andre S. Judice, mental health awareness is the recognition that our psychological well being is an important part of our own health, productivity, and happiness, as well as the well being of our community. Means, as an individual here, mental health awareness means we have to recognize that we are psychologically fit or not. We are able to perform our duties perfectly, properly or not. We are happy in our life or not. We are satisfied and our neighborhood, our society, our family, with them we are able to adjust and they are happy with us and we are happy with them. So, in simple words, mental health awareness is the recognition of our psychological well being. Mental health awareness increases the chance of early intervention, which can result in a fast recovery. If we are aware about our mental health and if we are facing some problem, so it can help in the early recovery. As we will come to know the problem soon, quickly we can visit doctor, we can find solution and recovery can be faster. Awareness reduces negative adjectives that have been set to describe our people with a mental illness. By raising awareness, mental health can now be seen as an illness. These illnesses can be managed by treatment. Thus, it becomes now opportune to explore the paradigm of mental health awareness as means of combating stigma, enhancing prevention, ensuring early recognition, and also stimulating simple and practical interventions within the community. Today, There are opportunities in terms of growing acknowledgement of mental disorders as key targets of global health action, as well as of leveraging new technologies, particularly internet, big data, and cell phones in amplifying simple field interventions found successful in primary care and other accounts. What is mental health awareness? Basically, it has two components. First, we pay attention to our mental health. It is the legacy of mental illness in my own family of origin and how does it affect my day to day life. How I am dealing with the experiences, both positive and negative, that I had growing up. What is my attitude towards my own emotional difficulties? Am I able to relate to them non judgmentally and with compassion? So it means that we should be aware of the above aspects, that whether we are able to deal with these aspects positively, we are not facing any problems due to this, we are not judging anything, so we can be considered as aware about our problems or the mental health. Second, we recognize the impact of mental illness and emotional suffering from those around us, friends, family, and the larger community, and begin to struggle with the question of how this awareness can inform our day to day lives. What are our attitudes toward those we encounter who are struggling with severe mental illness? Over time, we hope to find ways to support them in their struggles and to recognize our ultimate interconnectedness. How do you know that individual is suffering from mental illness? If the individual is feeling sad or down, he or she is confused, could not take decision, thought process changes, mood swings, could not concentrate, excessively fearful or worried, feeling excessive guilt, extreme mood changes. If such symptoms can be observed, we can try to find out the problem behind. Here are some of the simple steps an individual can take to help or to raise the collective consciousness about mental health. We, an individual, can help such persons through talk, means if we observe such problems, we should talk. We should open up about our own experiences, encourage kind language, educate yourself as well as others about mental illness, coordinate a mental health screening event, be volunteer to help others, those who are suffering from such problems, leverage social media. So try to help the people through these aspects. In today's scenario, people are suffering from many problems. So mental health awareness is very important. If we are aware about our mental health, our well-being, then only we can be happy, we can work productively, we can adjust with society, we can deal with the situations, we can have a proper decision making. So try to see that if you are suffering or any individual is suffering from mental illness, help them out at your level, guide them to visit doctor, and whatever the possible help can be given, try to give it. Thank you. Once again, thank you to HRDC and Department of Education for providing me this opportunity to interact with you all. Thank you all. I'm Dr. Renu, Principal, JG College of Education. Would like to thank HRDC Gujarat University as well as Department of Education for giving me this platform to interact with you all. Thank you HRDC and Department of Education, HOD, Dr. Milan Mistry sir, for providing me this opportunity to interact with the candidates of refresher course through the topic mental health awareness. Thank you. We have already seen in our earlier session that what do we mean by mental health? What do we understand by mental health awareness? What are different types of mental illnesses? And what care we have to take care so that we can perform our activities, our work properly, perfectly. Today, again, we'll continue with two more types of mental illnesses and what we can do to be aware and how we can be mentally healthy so that we can have good life, we can adjust with our neighborhood, we can perform our duties well, we can work productively. So, basically, when we talk about mental health awareness, we have to talk about mental illness. Because once we are knowing about the mental illness, then only we can talk about the awareness. Mental illness basically affects almost 19% of adult population, 46% of teenagers, and 13% of children each year. People struggling with the mental health may be our own family members, maybe the people living to next to our doors, may the teachers who are teaching our own children work with us, or the people sitting just nearby us in our church or temples, or anywhere people nearby us may be suffering from different types of mental illnesses. However, the people who are basically suffering from mental illnesses, only half of them are able to receive the treatment, often because of the stigma attached to mental health. Untreated mental illness can contribute to higher medical expenses, poorer performance at school and workplace, fewer employment opportunities, and a high level risk for suicidal tendency. We have already seen the types of mental illnesses, and that in our last session we have discussed about mood disorders, something related to depression. We have also discussed about anxiety disorders, what can be the complications, when to see doctor, what can be done to recover from that. Today, again, we'll see two more types of mental illnesses. One, the personality disorder, other, the psychotic disorders, that is schizophrenia. There are other disorders also like eating disorder, trauma related disorders, substance abuse disorder, which we will see in our later on sessions. Now we'll discuss in detail about the personality disorder. Again, this is a very important type of disorder which affects individual's life. A personality disorder is a type of mental disorder in which individual has a rigid and unhealthy pattern of thinking, functioning and behavior. Rigid means the individual is not ready to listen to anybody else. Whatever he thinks it is correct. The pattern of thinking is unhealthy, means negative thoughts are more, and that only is seen in the behavior also. A person with a personality disorder has trouble perceiving and relating to situations and people. Means these type of people are not able to understand the other people's situation. They are very reluctant. Whatever they think that is correct. This caused significant problems and limitations in relationships, social activities, work, and school, as they are not able to understand others, they are not able to understand the situation of others, they are rigid, so they face many problems in their relationships because people are tired, people don't like their attitude, and due to that they suffer a lot many problems in the relationship and social activities, even at workplace, even at school. In some cases you may not realize that a person have a personality disorder because the way they think and they behave, it seems very natural, but they always blame others for the struggles and the challenges in their life. They don't want to accept that they are having some problem. They are not able to face situation. They are not able to adjust with the situation. But for all the shortcomings, all the limitations, and for all the challenges, they just blame others. Personality disorders usually begin in the teenage years or early adulthood. There are many types of personality disorders. Sometimes may become less obvious throughout middle age. The symptoms of the personality disorders are grouped into three clusters, basically based on similar characteristics and symptoms. Many people with one personality disorder have signs and symptoms of at least one additional personality disorder. It's not necessary to exhibit all the signs and symptoms listed for a disorder to be diagnosed. Means it can be one, it can be two, or it can be multiple disorders. Different symptoms can be seen. There is no fixation or no fixed time that with these symptoms, these things will happen. It depends individual to individual that what symptoms and how severe the disorder or the problem is. Now we'll see one by one all the three clusters. Cluster A includes personality disorder. Cluster A personality disorder are characterized by odd, eccentric thinking or behavior. They include paranoid personality disorder, schizoid personality disorder, and schizotypical personality disorder. Now we'll see one by one in detail all these types of personality disorders. Paranoid personality disorder. In this, basically, the symptoms which we see are pervasive distress and suspicion of others and their motives. Means, whatever the individual is seeing, it is always negative. They are very suspicious about the behavior of others. Unjustified belief that others are trying to harm or deceive you. They think that the people who are nearby them, they are trying to harm them. They are planning something for them. So they are always suspicious. Unjustified suspicion of the loyalty or trustworthiness of others. They always suspect that the individual near to them are not loyal to them. They don't trust them. They are always suspicious. Again, they are very hesitant to confide in others due to unreasonable fear that others will use the information against you. They are also very angry or hostile reaction to perceived slights or insults. Perception of innocent remarks or non threatening situations as personal interest or attacks. Tendency to hold grudges. Unjustified, recurrent suspicion that spouse or the sexual partner is unfaithful. So, in short, in paranoid personality disorder, an individual is suspicious, he does not trust anybody, that the individual is loyal to them, they are fearful that the people will attack, they will harm them, they will insult them, and they are not loyal. So they are always suspicious, and due to that, they are not able to remain calm, quiet, happy. Next is schizoid personality disorder. Here, the basic symptoms which can be seen are lack of interest in social or personal relationships, preferring to be alone. Means the individual is not taking any interest in social or personal relationships. They prefer to be alone. They want to be aloof. Limited range of emotional expressions, as they want to be aloof, they don't want to remain with anybody else. So there are very less or very limited emotional experiences, expressions. Inability to take pleasure in most activities. They are not happy. They don't want to be with anybody else. They want to be aloof, alone, avoid social activities. And if they are there, they don't feel happy, they don't enjoy, they don't have pleasure. The next symptom is inability to pick up normal social activities, as they want to avoid the situation, they don't want to be part of any social activities. Appearance of being cold or indifferent to others. Even if forcefully they are with somebody else, they don't show interest in talking to them. They don't show any interest the activities which are going near to them. So they are very indifferent. Even they are the part of activity, but they don't show any interest, and they avoid the situation. They want to leave the situation where they are. The next type is schizotypal personality disorder. Peculiar dress, thinking, beliefs, speech, or behavior. These are again symptoms of this type of personality disorder. Odd perceptual experiences, such as hearing a voice whisper your name, flat emotions, or inappropriate emotional responses, social anxiety, and a lack of or discomfort with close relationships, indifferent, inappropriate, or suspicious responses to others, magical thinking, believing you can influence people and events with your own thoughts, believe that certain casual incidents or events have hidden messages meant only for you. Means here the thought process is that the individual thinks that I am something or I am the important one and something is done for me. Here in some places they are very indifferent, they are inappropriate to the response of the others, they are not comfortable in the close relationships. Many times their behavior is very odd. If they are sitting somewhere, they think that someone is calling them, someone is whispering and talking about them, even though it is not happening. So, this type of personality disorder, if two or three persons are sitting and they are having some their own talks, the individual thinks that they are gossiping about them, they are whispering their name, they are talking. So the individual is very suspicious about all these things, even though the thing is not at all happening. Now we'll see the cluster B personality disorders. In cluster B personality disorder, it is characterized by dramatic, overly emotional, or unpredictable thinking or behavior. They include, again, few types of personality disorders like antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Now again we'll see in detail what these type of personality disorders are, what symptoms they have. So the first is antisocial personality disorder, in that the individual is having disregard for others' needs or feelings. Means the individual is not respecting the feelings of others. Persistent lying, stealing, using aliases, conning others. Whatever the things are asked, they are always lying. They always tell different thing whatever is actually happening. So they are not truthful. Stealing. All these are antisocial activities. So this type of personality is engaged with all negative pattern of behavior, recurring problems with the law. Negative acts means not abiding by the rules and regulations of our law. So they are always having the problems with the law. Repeated violation of the rights of others. Aggressive, often violent behavior. Disregard for the safety of self or others. Impulsive behavior. Consistently irresponsible. Lack of remorse or regret for behavior. So, this type of people are not at all feeling any regret or guilt of their misbehavior. They think whatever they is doing, they are right. They are always trying to hurt others. They are not bothered about the safety of others. They don't respect others, and always they are trying to have negative behavior which is harmful for himself as well as for others. They are very irresponsible individuals. They don't have any responsibility for their family, for their neighborhood, for their society, or the country. So rather than involving in some productive activities, they are always involved in some unproductive or illegal activities which is not accepted by the society. Next is the borderline personality disorder. Borderline personality disorder is impulsive and risky behavior. such as having unsafe sex, gambling, or being eating. Unstable or fragile self image, unstable and intense relationship, up and down moods, often as a reaction to interpersonal stress, suicidal behavior or threats to self injury, intense fear of being alone or abandoned, ongoing feelings of emptiness, frequent intense displays of anger, stress related paranoia that comes and goes. So, borderline personality disorder is something where we are not at all stable. Our mood swings, suicidal tendency, or self injury is there. The people or the individual is threatened. He has a feeling that he will be alone or he or she will be abandoned. There is a feeling of emptiness, aloofness. They are so stressed, frustrated, and due to all these problems, they could not enjoy their life. They could not work properly. They could not be with the person near to them happily. And the individual or the person near to them are also fearful because of their this type of problems, and actually they don't want to be with such persons. They avoid, and due to that they feel loneliness, avoided, emptiness, which results in anger and all negative behavior. Next type of cluster B personality disorder is histrionic personality disorder. In this, constantly seeking attention. An individual tries to seek attention in any of the manner. If people are not giving attention, they may do negative activity also. So attract the attention. They can misbehave just to seek the attention. Excessively emotional, dramatic, or sexually provocative to gain attention. Speaks dramatically with strong opinions but few facts or details to back them up. Easily influenced by others. Shallow, rapidly changing emotions. Excessive concern with physical appearance. Thinks relationship with others are closer than they really are. So, this type of personality disorder, the individual has different symptoms. They try to gain or seek the attention anyhow. They will speak such thing which is factless, for which they don't have any base, but just they speak that people pay attention to them. They are very easily influenced by others. They don't have their own decision making or judgment that what the individual is saying it is correct or not. But whatever the person is saying, the individual is influenced. Their emotions change very rapidly, and if the person talks smoothly to them, they think they are very close to them. Just with one or two meeting, they think that they are their close relatives or the best friends with whom they can share anything. So, just to get attention, they are able to do or they are trying to do whatever the thing which they should not do. The next type of personality disorder is narcissistic personality disorder. The symptoms which we can see here our belief that you are special and more important than others. So here it is something related to dream world or the fantasy. Means the individual thinks themselves that they are very special, they are very important, even though they are not. Fantasies about power, success, and attractiveness. They think that they are very powerful, they are very successful, they are very attractive. So wherever they are, they think that they are something. They are not able to recognize others' needs and feelings. They are just concerned about themselves that we are something, we are powerful, we are successful. Exaggeration of achievement or talents. Whatever the talent they have, they try to show off, they try to exhibit that again and again. So, here basically the individual has very little, but they try to exaggerate that thing, their achievement, their talent. They want to show off. Their expectation of constant praise and admiration is always there. They want that people should praise them, appreciate them, admire them. Wherever they are at public place, they feel that we are important in the group. We should be given importance. Arrogance means they show attitude that we are something, even though they are not. But they have such feeling. They just want to exaggerate whatever the small thing they are having with them. Unreasonable expectations of favors and advantages, often taking advantage of others. Envy of others or belief that others envy you. So as individual wants to show off, they are jealous of others also. If someone is there who is really beautiful or having talent, so they could not accept that aspect, and they think that I am something, I am the only one, the best in all, rather than expecting the accepting the fact that what is actually, we don't accept that fact, or the individual does not accept that fact and want to show off and try to seek attention and mainly need praise and admiration. Now we'll see the cluster C personality disorder. Cluster C personality disorder are characterized by anxious, fearful thinking or behavior. They include avoidant personality disorder, dependent personality disorder, and obsessive compulsive disorder. In this, the first is avoidant personality disorder. Here, the individual is too sensitive to criticism or rejection, feeling inadequate, inferior, or unattractive. Avoidance of work activities that require interpersonal contact. Socially inhibited, timid, and isolated, avoiding new activities or meeting strangers. Extreme shyness in social situations and personal relationships. Fear of disapproval, embarrassment, or ridicule. So, in avoidant personality disorder, mainly the individual is very sensitive to criticism or rejection. They want to avoid the social activities. They want to be isolated. The activities which need the interpersonal relationships, they try to avoid it. The next in cluster C is dependent personality disorder. Dependent personality disorder is excessive dependence on others and feeling the need to be taken care of, submissive or clinging behavior towards others, fear of having to provide self care or fend for yourself and left alone, lack of self confidence, requiring excessive advice and reassurance from others to make even small decisions. Difficulty starting or doing projects on your own due to lack of self confidence. Difficulty disagreeing with others, fearing disapproval, tolerance of poor or abusive treatment, even when other options are available. Urgent need to start a new relationship when a close one has ended. So, independent personality disorder basically, the individual is very much dependent on others. They are not able to take a simple decision, also. They totally depend on others for their self care. And once, if they are left alone with their relatives or the closer relationship, they want quickly to be in new relationship. They don't want to remain aloof or alone, but they are totally dependent on others and they fear for disapproval. They are fearful for abusive treatment. They are totally dependent on the close ones for their day to day needs, even for the small decisions, judgments of their life. The next personality disorder in cluster C is obsessive compulsive personality disorder. Here, basically, we can see the symptoms like preoccupation with details, orderliness, and rules. Extreme perfectionism, resulting in dysfunction and distress when perfection is not achieved, such as feeling unable to finish a project because you don't meet your own strict standards, desire to be in control of people, tasks, and situations, and inability to delegate tasks, neglect of friends and enjoyable activities because of excessive commitment to work or a project, inability to discard broken or worthless objects, rigid and stubborn, inflexible about morality, ethics, or values, tight, miserly control over budgeting and spending money. So, in obsessive compulsive personality disorder, basically, we see that the individual is very rigid and stubborn. He or she is not able to even throw the worthless objects. They think that it will be useful someday, even though it is totally useless. They are so perfectionist rather than trying to be so perfectionist. The rules and regulations we have, what they have decided for themselves, is so strict that they are not able to fulfill it and it results in dysfunctioning and distress because whatever the planning they have, whatever the perfection is they want to have, they are not able to have it, and due to that, they feel frustrated. They could not perform, they could not enjoy the work which they are having. They are very miserly, they have very strict budget, they don't want to spend more, they are almost trying to what we say acquire the things for a longer period of time. They are fearful actually that they will lose the thing, so they have very control or strict control on budget and spending of their money. So these type of symptoms, if is observed, then there is a need to see a doctor. If these signs and symptoms are seen, means the individual is suffering from some type of mental illness, and to maintain their mental health they should meet a mental health professional or doctor. If these illnesses are untreated, personality disorders can cause significant problems in life and which can be worsened without treatment. Personality is the combination of thoughts, emotions, and behaviors that makes you unique. It's the way you view, understand, and relate to the outside world, as well as how you can see yourself. Personality forms during childhood, shaped through an interaction of your genes. Certain personality traits may be passed on to you by your parents through inherited genes. These traits are sometimes called temperament. Again, environment. This involves the surroundings in which you grew up, events that occurred nearby you, and relationship with family members and others. Personality disorders are thought to be caused by a combination of these genetic and environmental influences. Your genes may make you vulnerable to developing a personality disorder, and a life situation may trigger the actual development. There are different risk factors, although the precise cause of personality disorder is not known. Certain factors seem to increase the risk of developing or triggering personality disorder, include family history of personality disorder or other mental illnesses, abusive, unstable, or chaotic family life during childhood, being diagnosed with childhood conduct disorder, variations in brain chemistry and structure. There can be a different complications which can be seen because of these type of personality disorders. Personality disorder can significantly disrupt the lives of both the affected person and those who care about what person. Personality disorders may cause problems with relationships, work, or school, and can lead to social isolation or alcohol or drug abuse. Now we'll see psychotic disorders. Psychotic disorder is also known as schizophrenia. Psychotic disorders are a group of serious illness that affect the mind. They make it hard for someone to think clearly, make good judgment, respond emotionally, communicate effectively, understand reality, and behave appropriately. When symptoms are severe, people with psychotic disorder have trouble staying in touch with reality and often are unable to handle daily life. But even severe psychotic disorders usually can be treated. There are different types of psychotic disorders. They are schizophrenia. People with this illness have changes in behavior and other symptoms, such as delusions and hallucinations, that last longer 6 months. It is usually which affects them at work, school, as well as their relationships. Schizoaffective disorder. People have symptoms of both schizophrenia and a mood disorder, such as depression or bipolar disorder. Schizophrenia informed disorder. This includes symptoms of schizophrenia, but the symptoms last for a shorter time, between 1 to 6 months. Brief psychotic disorder. In this, people with this illness have a very sudden, short period of psychotic behavior, often in response to a very stressful event, such as death in family, Recovery is often quick, usually less than a month. Delusional disorder. The key symptom is having a delusion, a false or fixed belief involving a real life situation that could be true but isn't, such as being followed, being plotted against, or having a disease. The delusion lasts for at least 1 month. Shared psychotic disorder. This illness happens when one person in a relationship has a delusion and the other person in the relationship adopts it. Next is the substance induced psychotic disorder. This condition is caused by the use of or withdrawal from drugs such as hallucinogens, crack, cocaine that cause hallucinations, delusions, or confused speech. Psychotic disorder due to another medical condition, hallucinations, delusion, or other symptoms may happen because of another illness that affects brain function, such as head injury or brain tumor. Paraphrenia, this condition has symptoms similar to schizophrenia. It starts late in life when people are elderly. The basic symptoms of these are hallucination, delusion, and disordered form of thinking. Hallucination means seeing, hearing, or feeling things that don't exist. For instance, someone might see things that aren't there, hear voices, smell odors, have a funny taste in their mouth, or feel sensations on their skin even though nothing is touching their body. Delusions are the false beliefs that don't go away, even after they have been shown to be false. For example, a person who is certain their food is poisoned, even if someone has shown them that the food is fine, has a delusion that the food is poisoned. Other possible symptoms of psychotic illnesses include disorganized or incoherent speech, confused thinking, strange, possibly dangerous behavior, slowed or unusual movements, loss of interest in personal hygiene, loss of interest in activities, problems at school or work, and with relationships, cold, detached manner with the inability to express, mood swings or other mood symptoms such as depression or mania. People don't always have the same symptoms and they can change over time in the same person. There are different causes for this. Doctors don't know exactly the what cause is there for the psychotic disorder. Researchers believe that many things play a role. Some psychotic disorders tend to run in families, which means that the disorder may be partly inherited. Other things may also be influence their development, including stress, drug abuse, and major life challenges. People with certain psychotic disorder, such as schizophrenia, may also have problems in parts of the brain that control thinking, perception, and motivation. In schizophrenia, experts believe that nerve cell reports that work with a brain chemical called glutamate may not work properly in specific brain regions. That glitch may contribute to problems with thinking and perception. These conditions usually first appear when a person is in their late teens, 20s, or 30s. They tend to affect men and women about equally. To diagnose a psychotic disorder, doctor will take a medical and psychiatric history and possibly perform a brief physical exam. The person may get blood test and sometimes brain imaging such as MRI scans to rule out physical illness or drug use like cocaine or LSD. If the doctor finds no physical reason for the symptoms, they may refer the person to a psychiatrist or psychologist. These mental health professionals will use specially designed interview, and assessment tools to decide whether the person has a psychotic disorder. Treatment is very important for these types of mental illnesses. Most psychotic disorders are treated with a combination of medication and psychotherapy, which is a type of counseling. The main type of drug that doctors prescribe to treat psychotic disorder are antipsychotics. Although these medicines aren't a cure, they are effective in managing the most troubling symptoms of psychotic disorders, such as delusions, hallucination, and thinking problems. Doctors usually first prescribe the newer ones because they have fewer and more tolerable side effects than older antipsychotics. Some of the medications are available by injections and only need to be taken once or twice a month, or even every 3 months. This can be easier to manage than remembering to take a daily pill. Again, psychotherapy is a type of treatment which can be given, including individual and family therapy that can help someone who has psychotic disorders. Most people with psychotic disorders are treated as outpatients, meaning they don't live in institutions. But sometimes people need to be hospitalized if the problem is severe. Each person being treated for a psychotic disorder may respond to therapy differently. Some will show improvement quickly, some others it may take weeks, months, or years depending on the severity of the problem. Some people may need to continue treatment for an extended period of time. Some, such as those who have several severe episodes, may need to take medication indefinitely. In these cases, the medication usually is given in as low a dose as possible to minimize the side effects of the medicines. So, finally, we can conclude that a mental illness is a physical illness of the brain that causes disturbance in thinking, behavior, energy, or emotions that make it difficult to cope with the ordinary demands of life. Researchers and starting to uncover the complicated cause of these disease, which can include genetics, brain chemistry, brain structure, experiencing trauma, and or having another medical condition like heart disease. Although the general perception of mental illness has improved over the past decades, studies show that stigma against mental illness is still powerful, largely due to media stereotypes and lack of education, and that people tend to attach negative stigmas to mental health conditions at far higher rate than other diseases and disabilities such as cancer, diabetes, or heart diseases. Stigma affects not only the number seeking treatment but also the number of resources available for proper treatment. Stigma and misinformation can feel like overwhelming obstacles for someone who is struggling with a mental health condition. Here are a few powerful things you can do to help. The first, showing individuals respect and acceptance, advocating within our circles of influence, learning more about mental health, which allows the people to provide help, support to affected families and communities. So, at the end, I would like to say that we should be aware of the mental illnesses. We should be away from the stigma or the stereotype thinking regarding the mental illness. And as soon as we find the symptoms related to mental illnesses, we should go to doctor, we should visit to doctor and try to treat the problem which we are facing through. So, mental health awareness is very important in the present scenario to remain happy, to live healthy life, to work productively, to adjust in the society. If we are mentally healthy, Then only we can live our life happily. So thank you all. Thank you HRDC. Thank you Department of Education. We'll conclude our lecture here. Thank you.